In the heart of northern Nigeria, Kano stands as a beacon of commerce and tradition. It is Nigeria's largest city by population and second largest industrial center. Beneath Kano's rich historical colors, its bustling streets and vibrant markets, a dark reality of pervasive drug abuse and other vices threaten its youth population. A conservative state now struggling with modern-day challenges. This bottle of codeine cough syrups and expectorants litter many streets of Kano metropolis, a sign of a growing concern of substance use and dependency. In the slummy parts of Yakasai, a community within the Kano metropolis, we met a group of young substance users.
Sannan na fara mu'amala da wayannan abubuwan idan na kiyasta yanzu ya kai shekara wata 10 ga ko 9 na fara shan wayannan abubuwan saboda tun ina primary school. Ni na ce wai rayuwa ce ko kuma wani abu da na rasa na rayuwa ne ya janyo ni cikin shaye-shaye. Gaskiya na yi ƙarya, na yi wa Allah ƙarya, duk damammaki iri-iri Allah ya bani to amma akwai wani abu da aka faɗa aka ce mutum kaddararsa kowace iriya ce idan ta zo mai sai ya shanye ta. To mu gani muka yi gaskiya za mu zo mu wuce mu ga ana yi ko kuma mu ga ana rigima sai abin ya fara shiga zuciyarmu. To tun a aji muka dan fara gwada da irin chalk din nan da waye mu dan bubbuga chalk a takarda mu yi waye har ta kai da ta kawo mun zo gurin wayanda za su dauko su murza su ba mu sha ma'ana wiwi ko kuma mun ba mu da kuɗi ma a cewa na zo shi ya fitar da kuɗin sa mu siyo mu sha tare har ta kai ta kawo ta mu ma mun fara zare kuɗin jikin mu muna siya muna sha muna siya muna sha.
Muka samu kanmu kuma a cikin yanayin anguwa akwai geto a gurin zama na shaye-shaye muka dan sha'awa ba zai gurin haka ba yau to yau da gobe sai muka samu kanmu a cikin wannan shaye-shaye. To amma muna kan shaye-shaye nan muna yi yau da gobe ya zama na kasawa muke mu siya saboda me babu sana'ar da za a yi bari a ci abinci ma ya zama rayuwar mutum da mu je mu sata abu kai ko a kayan wani sai mu ga kayan shaye-shaye sai mu siya. Shaye-shayen da nake da dan na gurin da sun sani babu gagge kamar ni wallahi a unguwan nan inda ba gagge Allah ya tsina kamar ni dan na kwana a kwata na kwana a makara ba masallaci.
Experts say there are numerous causal factors to substance use and dependency, especially within the state.
Environmental factors would include accessibility to that substance. Accessibility, we talk about geographical accessibility because when you live in an environment that you easily get access to that substance, you can easily get it and use it. And then peer pressure, environmental peer pressure from school, peer pressure from neighborhoods, especially disadvantaged neighborhoods. Kano especially has a lot of disadvantaged neighborhoods, slums, slumpy areas. So children from those type of areas are usually more prone to using substances.
For sociologists like Professor Mekano Madaki, issues within family are the predisposing factor to such menace.
Talking about the social, you need to begin from the family. What happened with our family system? One of the fundamental societal factors that has contributed significantly in making drug abuse an issue in Kano is a breakdown of family system, family values, immorality, then peer group influence, which tend to have been playing significant role in shaping the personality and again guiding in most cases negatively the teeming population of our youth in the state. And when you look at the situation of the family in terms of the breakdown that has happened through broken home, inadequate parental guide or supervision, then the issue of domestic violence, the issue of crisis within the home, the issue of divorce, high rate of divorce, the issue of neglect and discrimination among the family members, and then also the issue of community I don't care attitude in terms of what has been happening within. That has contributed.
Kano's political atmosphere is often a heated one. Politically, it is the most sought after state due to its massive voting strength. This trend, according to Professor Madaki, is used to further aggravate the menace of substance use.
You realize some of our bad politicians are exposing our teeming population of youth to drug abuse because they are hired, they are sponsored, they are sometimes provided with these drugs, and they consume them in the name of providing what they call political protection to serve as political guards. And serving our political vanguards in most cases cannot be done under normal psychological condition, which makes them to get predisposed because some of the bad politicians are providing or supplying them with certain categories of substances that these youths are abusing, which eventually contribute and add to the problem of drug abuse in Kano State.
Beyond Kano, the 2018 report of the United Nations Office on Drugs and Crimes estimates that over 14 million people between the ages of 15 and 64 have used mind-altering substances in Nigeria. Kano, with over 20 million population, according to the UNODC report, has the highest prevalence of 12% or over 1 million substance user, the highest in the Northwest region. In 2021, the National Drug Law Enforcement Agency's boss, Buba Marwa, revealed that the figure had reached about 2 million and a 16% prevalence. Though substance use is prevalent among men, women are not left behind. Zara'u lives with her son at Niger Road in Sabangari area of Kano State. She lives among other female substance users.
Gaskiya a harkan shaye-shaye ina shaye-shaye amma ba wai dan ina so ba, amma kaddara ta ce ta zo mu a haka. Ina shan kodin, ina kuma shan roci, ina shan sigari. Gaskiya rayuwa ce ta kawo ni cikin wannan abin da kaddarar mutuwar aure. Na yi aure ina da 'ya'ya guda biyu kuma aure na ya mutu. Tun daga wannan lokacin na fara samu ina yin tafiya ina business kuma Allah ya fara sani a cikin harkar rayuwar yawo. Na fara yawo, lokacin da na fara yawo kuma na zo ina dan dai jijjiye business har Allah kuma ya kaddaro ni nan na zo na samu 'yan uwana mata.
Though there are no readily available statistics of women users, medical experts say their involvement with substance is on the rise.
Let me not finish this discussion without particularly giving emphasis to use of substances among females, which is now becoming more and more rampant. Because according to this United Nations Office on Drugs and Crimes statistics estimates, it gives an estimate of 1 in every 4, one woman will use substances. Like the ratio is now becoming like 1:4. When you find every 4 men, 4 young men or adolescents using substance, you will likely get 1 female using substance, which I think is very high in number, because ultimately that woman becomes a mother, she becomes a grandmother, she can also become somebody in the society, because we usually look up to women as teachers, as guardians, and as support system.
At the State's Drug Agency's Rehab Center, we spoke to 2 recovering patients, Awal, who has been dependent on cocaine for 18 years.
The journey was really difficult, and it was something new for me, because I came here as someone that has, my life was destroyed because of cocaine, and I've lost the track of time. I lost almost everything. So my hopes were lost, and I think I may not be the same person as I was. So I came here as a wrecked person, devastated and full of regrets. So when I came here, I realized that my first week here, I started to realize all the mistakes I made. Like, I made so much mistakes. I lost so many opportunities, so many things. People that are far behind me, they are past me in real life. So I started to realize that. And, with the help of all the staffs, and everybody here and so much counseling, I started to figure out myself. I started to figure out all my mistakes and how to be a better person. And the journey was still on. And inshallah, I hope after this journey, I will be a much, much better person.
In the same facility, Fatima is on treatment for crack cocaine.
It's my worst regret, and I'm trying to fix things. From here, I don't think I would do anything that will I'll make up for the time I've lost. It's something I regret deeply. I really don't want to go back to it. So I know, yeah, I've lost, but I'm working on it.
Generally, about recovery of substance use is we want everybody, especially parents, caregivers, and other health care workers that are not into the services of substance abuse, to realize that addiction is a chronic, remitting and relapsing illness. What is remission? You can get well, you go back to your normal activities. Remission. We can say you have remitted from an illness, maybe a cancer. He's in remission. It means the cancer cells are no more bothering the body. And then what is relapse? Relapse is going back. The disease has come back. So addiction is a chronic, remitting and relapsing illness. So you can get well, and then after some time you can go back to using that substance.
Substance of choice, according to the NDLEA, range from cannabis to pills like tramadol, diazepam and rohypnol, to codeine cough syrup and other inhalants. To understand how accessible these substances are, we went undercover at one of the black spots of pocket dealers, the Sani Abacha Stadium. The stadium, which took the center stage during the 2000 African Cup of Nations and the 2009 FIFA Under-17 World Cup, is now a safe haven for drug peddlers. Pocket dealers are the most accessible to users, and they are at the bottom of the chain of drug business. While sporting activities are on, the dark trade takes place under the bleachers. Cannabis, assorted pills and cough syrup were on display for interested buyers. For as low as 15 naira, one could get high on XO. But for the big dogs, 6,000 to 7,000 naira is the price for Max Cough or Bronclair codeine cough syrup. While these young men turn a monument into a hideout for bricks business, another type of drug has found its way into the state. Popularly called ice, Dr. Asmau reveals that this stimulant contains higher addictive properties, and this no doubt signals more danger.
Now there is an advent of a new substance we refer to as methamphetamine, commonly referred to as ice, other names, but the commonest names given, the street name is ice. The major problem with methamphetamine is it is a synthetic stimulant that even has more addictive properties than cocaine. We know cocaine is highly addictive, but methamphetamine is much more addictive than cocaine. And the worsening aspect of it is now almost always on the increase every day on the streets of Kano. While I started my residency as a young doctor in this department, we have never seen anything like methamphetamine. We have a form of urine toxicology which you screen substances. Methamphetamine is one of them, but we have never seen any positive for methamphetamine. But the most scary thing is now we see a lot of positives for methamphetamine. There was a time, out of a total of 7 patients in the ward, I had about 4 patients 4 patients that were solely using methamphetamine.
But the state's drug enforcement agency says they are making efforts to reduce the volume of substances on the streets.
No, we were able to assist over 4 tons of various illicit substances, almost getting to 5 tons, I can tell you. Out of this seizure, 2,321 kilograms were just cannabis, that's Indian hemp. That we use, or marijuana, as people will call it, what we seized. And other psychotropic substances made of the remaining, that's about 2,446 kilograms of various as assorted. So to tell you that the volume of what has been removed from the society is high, over almost getting to 5 tons within 3 months is a high number. I think of this quantity of substance having its way into the society, the kind of havoc that it will cause. Also, within the period, we were able to arrest the drug dealers. Not all these joints that will go and get some people with 1 or 2, whatever. The real merchants of drugs in Kano were able to apprehend about 319 dealers. Of course, out of them, 14 are female drug dealers, as female women that sell drugs to people in the public.
Amidst a growing concern of drug use, treatment becomes multifaceted. Kachako Islamic Medicine Center, founded by Dr. Yakubu Kachaku, takes the Islamic approach to rehabilitation.
Su za ga asibitoci sukan duba abin ne a ce psychological problem, medical problem, shi suka fi duba. A gani, mu kuma za mu duba psychological problem, medical problem and spiritual problem. Wannan su muka fi duba mu. Idan aka ce ga matsala za mu kalle ta fuskar psychological issue, wato bangaren wato tunani. Sannan za mu duba ta abin da ya shafi cutuka. Sannan za mu duba shi abin da ya shafi kuma wato spiritual, matsalolin mutanen ɓoye. To kaga wannan akwai bambanci a nan ta inda mu gani.
Idris is currently undergoing treatment at the center. Other patients call him Amir, an Arabic word for leader.
To abin da ya fi bani mamaki ko in ce ya fi ɗaure min kai ko in ce ya fi shiga cikin zuciyata. Ina jin kwana na 5 zuwa 7 ana min addu'o'i, aka bani wani magani na sha sau 1. So tun da aka bani wannan maganin na sha, sai na ji a zuciyata ma ba ni da sha'awa ko buri nan ƙara shan wani abu.
From his perspective, Dr. Kachako believes substance dependency can also be diabolically inclined.
Idan za ka kalli abin da yake jawo sai da kayan yawaitar shaye-shayen ƙwayoyi, akwai abokai, sannan akwai rashin aiki game da aka sha faɗa wanda kusan shi ake dalilin aka fi kuja da shi, amma ban da wannan akwai matsaloli da suka shafi kayan abubuwa na ɓoye. Abu na farko shine kamar tsinuwar iyaye ga yaya. Uwa wajen tarbiyya ta zama tana la'antar yayanta. Kai wannan tun daga cikin ciki ba. Ni ban taɓa ganin azinan ciki irin wannan. Kai wannan ciki Allah wadare. Kai dai wani Allah wadaren halinka. To wannan abin yana yi tasiri ga yaro in ya girma kama shaye-shaye. Sannan banda wannan za ka iya samun kuma akwai baki na mutane. Wani yana da basira, yana da hazaƙa, a makaranta shi ke na 1 ko shi ke na 2, wani ya ce kai ɗan gidan wani ne haka. To wannan kaɗai idan shi yana da kambun ido ko kambun baka, wannan yaron zai iya kamuwa da matsala kuma ciki ta shaye-shaye.
The 2 religions we practice in Kano prohibit drug abuse. So Kano State Hizbah Board, with collaboration with any other religious organization, will fight this dominance of drug abuse and drug addiction. If you go around, not only drugs, even beer here in Kano is prohibited. So we are warning, I am still telling anybody anybody we caught taking hard drugs will definitely pay the consequences here in Kano State.
The warning by Hisbah, Kano's Islamic and moral police responsible for the enforcement of Sharia laws, has done little to end the menace. But there is hope. Some rehabilitated drug users now provide free intervention for users. Abubakar Meitumaki heads the Youth Awareness Forum on Drug Abuse, Yafuda, and says they have successfully rehabilitated and reunited hundreds of users with their families.
A cikin yaran 400 mun mai da yaran state guda 15 a arewacin Najeriya, wanda majoritin su 'yan arewa ne. Ba mu samu dan southwest ko south mutum ɗaya ba, duk date. Duka wayannan abubuwan da kake ganin su 'yan arewa ne. Out of 19 states na northern Nigeria, state guda 4 ne kawai ba samu ba.
One of such success story is that of Sani.
Ina ragewa ne a hankali idan ina shan guda 10 na dawo shan guda 5 na dawo shan guda 3 na dawo dai da addu'a da waye dai Allah ya taimaka aka daina yi. Gaskiyar magana na sha wahala kafin na daina, ban samu sauki ba. Na sha wahala kafin na daina. Amma lokacin na fara ina jin daɗi sosai. Na fara lokacin da ina jin daɗi sosai, amma kafin na daina na sha wahala gaskiya. Na yi yaƙi sosai kafin daina gaskiya. Kawai wannan lokacin ya zama to idan ban sha shi wannan abu ba na jin daɗi a rayuwa na gaskiya. Sai na sha nake zauna lafiya. An ban sha ba na jin daɗi gaskiya. Wahalan da na shiga kenan, shi ne wahalan da ya bani. Ya zama addictive a tare da ni. Ni yanzu gashi dan hankali na ya kwanta, na zama cikakken full man yanzu. Na zama babban mace yanzu, ina harkoki na, I am doing my business successfully. Everything, wallahi. I don't compare that time and this time. There is a lot of differences. Akwai bambanci sosai gaskiya.
Amidst a critical demand for mental health care facilities, Kano's Reformatory Institute for Rehabilitation of Substance Users in Uri local government area remains a graveyard. Officials on ground say this is due to ongoing renovations. Even with the new Federal Neuropsychiatric Hospital, formerly called the Dawano Psychiatric Hospital, officials say the available human and material resources is inadequate.
Right now, I don't think both public and private beds for treatment will even cater for probably even 10% of people with problems that requires admission to hospital, for instance. Those with severe problems. And even those with mild, moderate problem, we don't have, I don't think we can even, if they decide to come to hospital, all of them, I don't think we have the number of staff that will be able to cater even for quarter of them. Hopefully in the next 1 year, we will have a dedicated place for admitting patients with substance use, and we increase the number of beds and number of personnel that are. But this place is a place where treatment will be offered, training will be offered, so we are hoping to get increased number of manpower that will be addressing this aspect of substance use and other mental health problems.
In a place like Kano, where traditional values meet modern challenges, there is little help for women like Zara'u.
The barrier to care is more for women than for males. Now, with this example, at least we have a ward specifically designed for addiction for males, but for females we don't. So we have to accommodate them in the normal open ward for female other psychiatric patients. There is a lot of stigma and discrimination for people that are using substances, but for women, it's the highest. So that stigma, that discrimination and stereotype will always hold them at home, will not allow them come to seek for the care.
The message that I have for the drug merchants: you should deter from destroying the lives of individuals. There is a law meant for that, and we are ready to implement it to the fullest. I can tell you that we will not spare anybody. Nobody will be spared if he is found involved in any way, either in the transportation, advertising, selling, distributing, producing any substance of abuse. If you are caught, be rest assured that you will face the full wrath of the law.
The Kano State government assures that it is concerned about the spike of drug abuse in the state and is doing all it can to check the menace.
I can assure you that the government is doing a lot in this regard, because during his first official assignment, immediately after he took out of office, he went straight to the Kiru Reformatory Institute to check its fitness for the challenges ahead.
Dr. Yakubu Kachaku believes more needs to be done for the state to achieve its aim on reformation and rehabilitation of users in the state.
Akwai buƙatar gwamnati ta sa idanu ta kan wannan wurin, ta dubi ƙwararru ta zuba a gurin. Za a iya kula da wannan gurin a kula in an sa ƙwararru. Gurin in aka bar shi ma zai ma idan gaba idan gwamnati an taimaka zai iya cin gashin kansa. To amma matsalar shine dole sai an samu ƙwararru, sai an kau da kai daga me za a samu, sannan a yage wato ainihin kiru daga women affairs ta ci gashin kanta, a yi mata directorate a bata abin nan, ko dai a yi mata agency for drugs abuse, ko a yi mata board ta zama sana ana mata budget ɗinta komai da komai nata ne, wannan shi za ku zama lafiya.
We have a huge generation to lose, an impactful generation to lose, a productive generation to lose, and a generation we look forward to because they are the leaders of tomorrow, that we are losing and will continue to lose because of substance abuse.
Those people who are supposed to be providing middle cadre manpower, or supposed to be undergoing some categories of training, for them to assume positions of responsibility in the future, are now becoming nuisance to the society.
As substance dependency continues to negatively impact on the lives of millions of youths in Nigeria and Kano State, experts advise that all hands must be on deck to ensure that the menace is being reduced to the barest minimum in both the state and the country at large.